Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, Analisa's back.
Hello.
And today we're recording a double episode. So I'm recording for the podcast, but I'm also recording an IGTV.
Yes, which is really cool.
Nice.
It's really cool. It's because everyone wants to use different platforms, you know, some want IG, some want YouTube.
Some want stories.
Yeah.
Some want feed. And what I want is just to make it accessible, right? So I want you to listen to it.
Yeah, exactly.
But what triggered today's episode was I've been seeing some really bad tummy tucks.
Yes.
And I want to teach and, educate you guys. Of course, we're not doctors. We're not medical professionals. We know a lot about this industry, but we are not giving you any type of diagnosis and we're not giving you any type of treatment.
We're basically just saying, hey, these are the questions that you have to ask when you go in for your consultation to help you make that consumer
informed decision.
Yes. To help you make a better,
selection.
I don't know. Yeah.
Well, really, it's kind of
it would be like if you or I and we had no information, we had no internet, and we had a girlfriend, and they're like, okay, I'm going to come with you to the consultation, and this is what we're going to ask, and these are the questions that we're going to ask.
You guys, I have something to tell you. Not all tummy tucks are the same.
They're not.
No.
Absolutely not.
They might say they're the same. Doctors might tell you it's the same, but a tummy tuck done by a general surgeon is not going to be the same as a tummy tuck done by a plastic surgeon.
Correct.
Would you agree?
I agree.
So we in the field, we can see when it's a good tummy tuck. And I'll even be like, dang, that's a really good tummy tuck.
And I think like belly buttons, right?
Yeah, belly buttons for sure.
I think my AirPods. This is how it's real life.
Yeah, real life. So there's some telltale signs that we know from being in the industry of good,
it's good,
bad,
it's not
excellent. Like you want to have an excellent result, right?
Absolutely.
So you need to know how to tell what an excellent result is, because most of the time, you guys, y'all don't even know they had a tummy tuck.
Yeah. I mean, you see some girls on the beach and you're like, oh my gosh,
she looks great.
Is that natural? And then I look and I'm like, no, that's not natural. That is a tummy tuck. But it was done by a great surgeon that can sculpt and knows what the anatomy of the woman's body should look like.
Exactly. So that brings me to this question that I get all the time. What is the difference between liposuction and tummy tuck? So we're like, it's an easy question, right? But a lot of patients don't know. And they think it's kind of like Botox and filler, like, oh, she had Botox. That's just kind of the generic thing.
Right.
Oh, she had her face done. She got some Botox, but they don't know it's really been filler or anything else. They just say Botox.
Like, it's two different things. Botox freezes, fillers does what it does. It fills.
So it's kind of the same, out there, lipo, tummy tuck. They think, oh, she had lipo, but in reality, it was a tummy tuck. So in your words,
Okay.
Tell our listeners what's the difference between liposuction and a tummy tuck.
So tummy tuck, think about it as like an internal corset. Okay. So you're addressing muscle tightening, skin tightening, liposuction. You basically
Remove
take
fat.
out fat. Yeah, exactly. So you can do liposuction without a tummy tuck, but usually you do
The great doctors.
both together. But you have to consider too with circulation, some doctors that are great, they're not going to do a tummy tuck with liposuction to the abdomen because of
And you
circulation.
And you shouldn't.
Yeah, you can always come back later. But honestly, if you do the tummy tuck, they take care of it.
Yeah, most of the time, unless you have
on the abdomen,
unless you have above your belly button, a very thick,
correct,
full, or it may be if that skin above your belly button is hanging over, you might have some looseness or might have a little fat that needs to be touched up. But most of the time, they get it with the tummy tuck. You don't need to go back.
You don't have to.
So if you are considering surgery for your tummy and you're like, I don't know what I need. These are, when I'm asking a patient a question over the phone, trying to figure out like, okay, which direction are we probably going to go in?
Yeah. Or getting pictures.
If I need to direct them how to take pictures, I need to know which direction we're going to go.
Right.
So most of the time, if you've had kids,
right,
and you've had your abdomen stretched, you've had a kid,
if you have
stretch marks, if you have your muscles separated,
correct,
if you have skin that hangs, most likely your doctor will recommend a tummy tuck.
Correct.
So,
because there's no amount of exercise that you can do to correct that. I mean, you can do X amount of crunches. You can
drink as much collagen as you want.
But it is not going to happen. Sorry, sweetie. Like, it is what it is.
It needs to be cut out. And that's just what it boils down to.
That's what we have the great surgeons for.
So when you're deciding or when you're thinking or you're looking at before and after pictures, this is something that I want you guys to know. When you're looking at a doctor's website and you're looking at before and after pictures and you're trying to compare and find somebody that looks like you, that picture that you're looking at, it might not be like, I don't know how to explain it. It's not.
Well, you have to make sure too that it's the same height, the volume, because you can't compare yourself if you're, okay, hypothetically speaking, you're 5'2" and 130.
Mm-hmm.
You can't compare yourself to a 5'8" and a 150.
No. And if you're looking at a tummy tuck and you come in and you are showing me your wish pic and it's somebody who works out.
Yeah.
And has not had any children and has had a tummy and has had liposuction only.
Kids. Yeah.
This is what we're talking about when we're like, we got to compare, apples to apples.
Right.
And let's manage your expectations so that later on you're not disappointed. And that brings me to the next point, which is how can you tell that the person that you're going to, if you've done your homework, they should know.
Right.
But how do you know that they're giving you the proper recommendation? Because I'm going to post some pictures on my feed for you guys of badly done tummy tucks or tummy tucks, liposuctions that really should have been tummy tucks.
Yeah, but they weren't. And I want you guys to know that sometimes it's better to just go with the tummy tuck. And I think it's hard because some patients, they're very apprehensive as far as the scars go, but it's a trade-off.
Mm-hmm. And I promise you guys, that trade-off is you're not even going to think about your scar.
Yeah. And you can actually go into your consultation and ask the surgeon, hey, do a mark on my, lower area and
show me where my incision could be or would be.
How low, how long, and then go home and see,
if your favorite bathing suit covers it.
bathing suits, your
or some lingerie.
Hey. Underwear, whatever you want, swimsuits, anything basically. But it's basically to see that you're comfortable before going into the surgery, if that's going to be a good trade-off for you.
Because
That's the biggest thing.
I think from feedback that I've been getting through Instagram, the main worry of women against the tummy tuck is the scar.
Yeah.
And this is what I have to say to you guys. Are you showing your lower abdomen right now? Are you showing your lower tummy right
you're
now?
Not doing it on a daily basis. Yes.
So
obviously in intercourse or your
partner doesn't even notice. They don't even notice. Yeah. They don't even care. They're busy.
Yeah. Exactly. So, but I think as women, it's still, we have that anxiety that we want to make sure that we feel confident. But on the flip side, you have more
scar creams, silicones, microneedling,
all those things,
tattooing.
Yeah, you have things that you can cover up with. But at the same time, you can have more lifestyle changes. Your clothing opens up.
Oh my gosh. You can dress with whatever you want and
your
you feel
wardrobe
good.
Opens up and it's like, oh my gosh, I didn't know I could wear this, that, the other, and no one knows.
Nobody knows.
Yeah,
nobody can see your scar unless you show, unless you're showing them.
Exactly.
So let's tell them now, what's the difference between a tummy tuck and a paniculectomy? How do you know which one you're a good candidate for?
So when you go to see your surgeon, you will ask this question. A lot of patients actually don't know what a paniculectomy is.
That's why we're going to teach them today.
Crazy. But it's basically just skin tightening.
It's skin removal. It's more like a skin excision.
Yeah. So you're tightening the skin, right?
Right. You're tightening the skin.
Versus a tummy tuck where you're like an internal corset and you're tightening internally and you're tightening the skin.
Right. So imagine if you're looking at your tummy and let's say you have an overhang.
Mm-hmm.
Imagine a paniculectomy. It just chops off. Sorry, that's so crude. It just chops off.
It's okay.
You guys,
we're being real. Sorry.
You just take off that part, that front part, that overhang, and then they close it. And that's it. And that's it.
But there's no muscle tightening.
Muscle repair. There's no shaping.
Nope.
That shaping is not a concern when you're doing a paniculectomy.
Literally, it's just skin tightening and that's it.
So those pictures that you see online where women look very square, that's probably a paniculectomy. And they're not getting tummy tucks because when they do a tummy tuck and they do that internal corset, it brings your waist in. It snatches your waist.
Yeah. So, a lot of patients are like, can you just snatch me as much as possible? I was like, yep.
Let's coming right up.
Let's snatch it and do whatever you want to do. So you get that tiny waist, you get that hourglass figure, and that's what we want.
So
that's what we want. Yeah.
This is what I want you guys to know. When you're looking at pictures online, those pictures, they're not all the same.
Correct.
And you have to learn how to distinguish what you're looking at. And that's what I want you guys, that's what I want to teach you guys, how to know that what you're looking at is good, because it might look good to you right now that you're like very excited and you're just exploring and you're starting to look at pictures. But then when you start looking at the quality of the work, for example, the scar, plastic surgeons are known for their excellent, magnificent, thin scars.
Okay, I'm going to back up on that because like if it's an emergency and you have to go into an ER, those surgeons are just making sure that you're good.
Mm-hmm.
You know, they're not worried about what it looks like or whatever. But if you're doing something elective, then go to a plastic surgeon or cosmetic surgeon that has that expertise.
Correct.
That has that hand.
Correct.
That can go as low, as thin, and as beautifully as possible. I don't know how much to say it, but
like if, for example, if you ladies are looking at pictures in other countries, look at those scars.
Good point, Mavi.
Yeah, that's what I'm talking about. Because I've seen bad stuff here,
right?
The bad results here from doctors who shouldn't be operating, but I've seen it from other countries more.
Right.
So I want you guys to learn.
And that's another topic, like FDA.
Oh, that's a whole other topic.
FDA.
I'm working on it for you guys.
Okay, thank you. I was like, FDA, they're in our back pocket and they're basically like your insurance for surgery.
Correct. Y'all already know, if you follow me on Instagram and you watch my stories, y'all know that earlier this week, I was like, you do not go out of the country and you stay here and no more.
Did. I love that episode. That was so good.
But then I started getting like so many messages from girls and they're like, hey, I'm in Colombia. I'm in Mexico. I'm thinking about this. I'm thinking about that. Like, I can't afford it here. And I understand. And that's why. And I told y'all, like, I want to serve all of you and I want to be able to help all of you. So I've taken the responsibility on of trying to compile, safe options out of the country as far as I know.
Right.
If you're going to do it, I'm not telling you to do it. I don't want you to go. But if you're going to go,
you have to understand what you're setting yourself up for.
Correct.
Yeah.
And always.
That's great.
Always look at it from every single angle.
Yeah.
You don't want to just look at something from one angle where you're like not seeing anything else. Right. Like, I'm going to get good surgery no matter what.
Yeah. You're like, and recovery and downtime and
hotel and who's going to take care of you
and flights
and traveling by yourself.
If something happens, what do I do? There's just so many.
Because if you think about it, guys.
Things. Yeah.
Okay. Flight, surgery, recovery, somebody to come stay with you. They got to miss work too. Yeah. And then you're missing work. You're missing more work because you have to stay out of the country. So then you're missing work. You're missing time away from your family. Yeah. Like during your recovery. And then God forbid, if anything were to happen, you are in another country.
Oh, who was it that was on the podcast?
Diana.
Yes. She made a great point.
She did. You don't know what unexpected circumstances
is going to happen. Like with the hurricane, right? She made that point. She was like, okay, this patient went over, to Mexico and he had surgery. Unfortunately, there was a hurricane. Had to stay on the plane for
13 hours.
10 plus 13 hours, whatever it was. And then she had to have a whole revision of her whole mommy makeover. It was like unbelievable.
Imagine the double
patient
expense.
Didn't know. She did what she was supposed to do. So it's not like she was in the wrong.
It's the doctor didn't do anything wrong. Actually, in that scenario, the doctor didn't do anything.
Wrong.
It's just unforeseen circumstances that you really have no control over.
So you have to remember that if you do decide to go on that journey, that you're going to have those possibilities with recovery.
Just look at with anything in life. We should be looking at it from multiple angles and, try to see the different sides of it before making any decisions. And I know doctors here in the States who don't charge much more than what you would have spent over there, or they charge the same once you add up everything else that you're spending, and they offer financing.
And you have accessibility to them if something goes wrong.
Correct.
And that, I think, is the most important thing.
Absolutely. If something happens, if something goes wrong, which y'all know I'm never going to talk to you about anything and say, oh, it's risk-free or there's no risk.
Nothing is.
There's risk.
Anything in life. Whatever you do.
There's always a risk. And I'm a scaredy cat. I'm a scaredy cat and I cry a lot. And I think I would cry myself to sleep every night if I was in another country recovering by myself.
Yeah, that would be scary. I haven't done it before. I don't encourage it. Just because we have so many great doctors
here that it's like, why are you going? But there is some doctors in Colombia that I'm like, wow, that looks amazing.
It does look amazing, but I'm like, can I show you this picture and this doctor in Colombia? Can you match this for me? And they're like, yes.
Coming right up.
Yeah, I can do that for you. And they're down the street. So
that's true. We do have some doctors here in Houston that have gone to Colombia to train with those surgeons.
Yeah, for sure.
So the techniques are here, ladies.
Yeah.
They're here.
I think you just have to do your homework, as we always preach. Also, too, ask friends if they've had surgery done. It's good referral. Mm-hmm. We always preach, hair, makeup, nails,
Go by referral.
Referrals are great. Go to 3 doctors at least to figure out if that's the surgeon that fits for you. Because this is elective. Mm-hmm. Yes, because you have to mesh with the staff, the doc,
personality, style,
absolutely,
your budget. Like it's all finding your doctor.
Hand in hand.
Yeah, finding your doctor is more than just liking their before and after pictures, because you can like a doctor's before and after pictures and meet them in person and be like, this is not the guy for me. This guy did not understand me. He didn't listen. He didn't listen and, whatever. But you could see somebody that has good before and after pictures, and then you go to their consultation and it's like match made in heaven.
Yeah.
And that's what you want to look for. You want to look for oh my God, this is it. This is who I want to do my surgery. They understand me. I feel comfortable.
As long as you feel confident and you're comfortable, go with your gut. It's good.
Yeah.
It's pretty simple.
We underestimate the power of our intuition and our gut.
We do. And as women and as just,
as women,
as humans in general, we forget to go with that sometimes.
Oh, yeah.
And it's kind of like you either do it or you don't,
I can tell you guys that I've had consultations with patients who had implants for 10 years and they're finally coming in to get them switched out. And they're like, I felt from the very beginning he was going to go too big. And it happens. It happens. And they know from the beginning, hey, this might be too big for me, but they still do it anyway, even though they had that gut feeling and then they hated it the whole time. And now they're coming in. So listen to your intuition, follow your gut. If you're not feeling this person across from you, there's
on to the next.
Trust me, there's thousands of doctors, of plastic surgeons and that's cosmetic surgeons.
About our,
that's
system is that you can always reach out and say, hey, this is what I want. This is what I'm looking for. DM, and we will give you certain
recommendations.
Yes, exactly. And you as the consumer can be smart and you can make that decision. There's no person to say, hey, you have to go to this person or that person. It's just go with your gut, do your due diligence.
Do your homework for sure.
And figure out what you want to do. And then just ask us questions. That's the whole point.
That's the whole point of this.
Yes. We want you to be educated and knowledgeable. And we've been in the industry for so long. Yes.
It's like, throw it at me.
Just ask a question. It's like, we can give you our advice and then you run with it. You go to the consultation. If you need help with anything, we're going to be there to kind of help coach and guide you. But in the end, that's our main goal.
Our main goal.
We're advocates because we've seen so many patients that had no clue, right?
No clue about
it's
anything.
crazy.
And that's what I want. That's what I want to help.
Yes, exactly. We just want to help and just be that person to say, hey, we're your girlfriend and call us if you need anything. And
that's it, you guys.
We're going to answer. We'll be real with you. We'll tell you. Don't worry.
If you've DM'd me, I'll tell you. You might need to lose a little weight, or maybe you need to wait a little bit longer after kids, because ladies, you do have to wait at least a year after you give birth.
Because you have to go down to the weight if you're still breastfeeding.
Mm-hmm.
That's a big thing.
And you have to give your body time to, your stomach, your ab muscles, time to try to get back to normal as they're going to before you go in trying to cut.
Yeah.
So reputable surgeons will not do a tummy tuck on you within a year after birth.
Yeah. It's really one of those things where you just have to feel confident, comfortable. And now I'm very proud to say that we're helping patients, many patients now that they don't know where to go to. There's so much information on the internet.
And you get lost.
You do.
I know when I was looking, even you guys, before I had my surgery, and I had already been working for like 10 years in this industry, if not more. I was online looking at before and after pictures and going through the process of what my patients would go through. And I'm looking at pictures and, oh my God, I hope I look like that. I hope I look like that. I want my butt to look like that. And it's so overwhelming. There's so much information, even for somebody who's in the field.
You can
get lost in those pictures and wishing and hoping and imagining in your mind of what you could look like. I did it. I was staying up till 2 a.m. looking at pictures. Thank God I didn't have to wait that long between when I booked and when I had it, because I couldn't sleep. It was only like a couple months. No, it was 3 weeks.
Okay.
I can't wait. I have anxiety.
It was still like a process. Just like anyone else, you have to have that team member to help you, to coach you. And that's what we're here for. So next question. Okay.
Mini tummy tuck versus regular full tummy tuck and extended tummy tuck. And how do you know when you're a good candidate for what?
Okay. And that's what the consultation is for, because really every patient is different, because you have a small patient, you have a medium patient, you have a large patient that might need to do dieting before because their BMI is too much.
And on that note, sorry to interrupt you.
Go ahead.
If you are being turned away because your BMI is too high, they're doing it for your safety.
Correct.
It is not an opportunity or a sign for you to go find a doctor who will do your surgery even with a high BMI.
Absolutely
it means the doctor who is turning you away has your best interest and safety in mind, and they want the best for you. So they're telling you it's not safe for us to do a tummy tuck with your BMI at 45.
Yeah.
We can't do that.
Especially if it's not in a hospital or a surgical facility that is accredited by the state. Because even though it's a private facility, they're still accredited like a hospital, but they're not in a hospital. So even though they're 5 minutes away, they have protocols, obviously, to, if God forbid something were to happen, they have those. But you have to understand as a patient, the surgeon is giving you information to say, hey, it's not the time right now. You have to do your due diligence because it's a 50-50 thing. You have to do your part. The surgeon does his part. And then you guys work together to make sure that your results are are going to be the best.
Your results are what you expect. Like if you go with a 45 BMI to a surgeon and you're like, hey, I'm just having trouble getting around. Just need to cut this, skin off. I'll take care of my, it's inhibiting my movement. Surgeons will do a paniculectomy. They'll do, okay, let's just get this,
just the
skin off. Let's get you mobile. But that's not going to leave you looking like those Instagram pictures that you're looking at with the tiny little waist and these.
And that's very important too. I'm glad you brought that up because sometimes patients will put a picture of an Instagram person and say, hey, I want to look like this. And we're like, no, it's not realistic. It's not achievable. You have to do this step, that step, or another before we can even consider it.
Mm-hmm.
And some patients get
upset. They don't like waiting. And would you? I wouldn't want to wait either.
I wouldn't want to either. I want it now.
Yeah, I want it now.
We're in this, world. We're instant
immediate gratification.
Yeah, exactly. But it's safe. You have to understand, even though it is an elective procedure, it is still surgery. So you have to do your due diligence with your clearance, your
health,
doctor,
your medicine,
everything.
Because if you are with the BMI of 45, I'm pretty sure there's something going on with maybe diabetes, high cholesterol, something's going on. And all of those things need to be under control before you go under anesthesia. So
don't get mad at your surgeon.
It's not your surgeon's fault.
If they say that, don't get mad. Be
glad.
Be appreciative and be thankful that you've chosen a surgeon that is honest and open and is
good. Yes.
You know what I'm saying? Like they're giving you advice to, you know what? We have a process. Let's do this first, then come back, once it's at a level base and we can do this. We
can do it. Yeah. Let's just get you to a healthier weight first.
Correct. Yeah.
And on that point, you guys, if your surgeon is turning you away for whatever reason it is, don't get mad.
Yeah.
Don't get mad at them. Yeah. They're trying to do the best thing for you.
Yeah.
And
it's a team effort too. I mean, I harp on this all the time because it's almost like where you are upset at them because they don't want to do your surgery. But at the same time, they have the best interest for you. So take that with a grain of salt. You don't want a surgeon that says, oh, sure, I'll take your money. Sure, I'll do this. Sure, I'll give all the risk to you. I mean, who wants that? It's elective. So you have to consider that as well. Be thankful for those great surgeons that are very educated and they've been in the industry for a long time and they are very ethical and they want the best for every patient. And that's why they're the great.
They're the great ones. Then that's how you can tell great surgeons from good surgeons from bad surgeons.
Poor surgeons.
Poor surgeons. So to the mini regular extended.
Sure.
So the mini tummy tuck for you guys who are thinking about it.
Mm-hmm.
A mini tummy tuck is when you are already kind of thin. If you're thin framed, if you're not, there's not a lot of skin. And most of the time, no muscle repair. Mm-hmm. Because mini tummy tucks are not, they're only going from your pubic hair to your belly button. But they're not going up above your belly button.
Right. No incision from the pubic to the belly button for the mini. Typically, it's
just across.
Across,
correct. But what I'm saying is they're not getting any muscle repair above the belly button.
Mm-hmm.
And so you have to be the right candidate for it to look right. Like you have to have no muscle separation. And
I agree.
And just enough skin right below your belly button very small, thin.
It's like those patients that work out and they're super fit. Maybe they have or have not had one kid, you know, because sometimes it retracts back if they had a kid early in their, you know, early
20s.
years. Yeah, exactly. That would be fine, you know, but if you've had
if you've had multiple kids,
it is what it is.
You need a full tummy tuck. And honestly, you guys, you don't save
feel
that
sad
much
about it, you know, and you get more lifestyle changes. You get, you know, more access to clothing that you wouldn't be able to wear, you know, if you didn't have that, because there's no amount of exercise that you can do. Let's be honest.
None.
That's going to fix it.
None.
There's none. Literally. You can do as many crunches as you want. It's not going to happen.
Absolutely.
That's why we have surgeons.
That's why we have surgery. So mini tummy tuck, thin, no muscle repair, you know, very little skin. Regular tummy tuck. Okay, you have skin and muscle repair. You want the internal corset.
Right.
Extended tummy tuck. So the extended tummy tuck is when it goes out into your hips.
Right.
So
think flanks. So when we say flanks, it's like the love handle areas.
Yeah.
So when you put on your jeans, it's like that little fat pad here on the side.
Yeah, your little
That's
love
what
handles.
you don't want, you know, and you want to clean up. And liposuction won't do the trick, because if you do the liposuction, you're going to be left with loose skin.
So when you are deciding, which one you should go with, or this is really not even for you to decide. Your surgeon's going to tell you
right off the bat. But I mean
for when you're looking at pictures, because I know y'all are looking at pictures. I know.
Hello. Yeah. Internet. Hello.
So when you're looking at pictures, look at pictures. I want y'all to look at pictures of procedures that are going to be like what you would be getting.
Right.
So if you,
and again, let's reiterate, look at people that are your height, your weight, your frame,
and your before. Like if you're looking, you can't compare a 25-year-old who had 360 liposuction to a 45-year-old with a tummy tuck.
Correct.
That's not comparable when you're looking for a wish pick.
Yeah.
So wish pick, you need to be looking at the procedures that are going to be appropriate for you. Right. Because then you're going to take it to your surgeon and be like, hey, this is what I want. And they're going to be like, no, you're not a good candidate.
It was like when I see like facial patients, they'll come in and actually they're coming in younger and younger, which is surprising to me. But they're like, I want to look like this person. And I was like, okay, well, show me one without a filter. And they're like, scroll. There's none. Yeah. And I was like, okay. So that's why there's a filter.
Correct.
Right. So it's the same thing with the tummy area. You just have to make sure that it's apples to apples when you're expecting certain things.
So this next question or topic, it's a little controversial. Drainless versus with drain.
Oh, gosh.
So right here, we have two opposing views, you guys.
We do.
I am 100% team drain.
I'm going to take
I want a drain.
Okay?
I want 2 drains. I want, that fluid to come out. If it's going to be there for a week, if it's going to be there for 2 weeks, I don't care. I would rather, this is me personally, because I had 2 drains.
Okay.
I would rather have 2 drains because I would feel better knowing that fluid is coming out and no collection of fluid will be under there.
Okay.
We differ in opinion because even if I had the option to go drainless, I wouldn't. I would still want. Put my drain in.
Really?
Mm-hmm.
Okay. And see, me on the other hand, I'm like, no drains. It's one less thing that I have to think about. less chance of staph infection. I already have to wear a garment. I already am like draining, whatever.
Don't scare these ladies telling them less chance of staph infection.
Well, it is.
Annalisa, you guys. Annalisa, we're in sales.
Seriously.
Okay? Annalisa, I can see the sales.
No, I'm telling you. No, if I'm doing that, I'm like, why would I want one more problem when a surgeon can take a little bit more time in surgery, tie down suspension sutures, and I might have a little bit of drainage for a couple of days versus...
But drainage coming from where?
From the ports, from where the incisions were.
From where the drain incisions would be?
Yes.
So then it's getting everywhere.
No, you put a gauze pad over it. It's kind of like a maxi pad. Okay.
You guys.
Let's be honest. Every girl knows what a maxi pad is. Okay. So you put the maxi pad on top. Okay. Where the drainage, once it fills up, you change it out. That's it. And I don't have to worry about drainage or someone emptying it out. And then on top of it, having a garment going over it.
Let me tell you why. For me, you guys, I was in the back, so I was seeing patients every day.
Yeah,
for years, I was seeing tummy tuck recovery patients post-op day 1, day 2, week 1, week 2, like for a long time. So in those first initial 2 weeks, they're not moving around that much.
No, but they have to move around.
No, they do. But what I'm saying is, when they start moving around and they have drains, those drains collect more. So what happens if it's drainless and the ports have closed and they're moving around more and now they're getting...
But they're open right now. So you have like a maxi pad.
Yeah, but I'm talking about once they start moving around. Because what I would see...
I want them to move around.
I know, but what I'm saying is I would see them in clinic.
Yeah.
Once they started moving around.
Okay.
The ones that had drains. I didn't see any drainless because I'm team drains.
I'm a team undrain.
You're team drainless. But what I'm saying is after 2 weeks, when I would be seeing them in clinic, the ones that would still have drains, or a week, once they start moving around more, there's more fluid coming into their drains.
But that's when they can get the lymphatic massages.
Yeah, but where is the fluid going?
Lymphatic massage. It goes through your lymphatic system.
Oh, yeah. I thought you were thinking, you were saying for them to like drain the fluid through these ports. And I'm like, those ports closed a week ago.
Literally, like it goes through your lymphatic system.
I'm still team drain.
Call me.
I'm a scaredy cat, you guys. So I'd rather have have the drain.
Less chance of infection, and it's one less thing that I have to worry about. It is. Don't argue with me. It's one less thing you have to worry about with the garments and everything else. Because think, you have the drains. You're pulling up and down garments.
I know.
Right?
Yeah.
Okay. It's one less thing you have to worry about as a patient on recovery. Okay. You're sore.
How about this, you guys? This scenario. Let's talk about this. Okay. You're saying one less thing to worry about, right?
Yes, because there's so much more.
But because I've had a tummy tuck and I had to have drains. So when you put your garment on, you put your drains through the crotch and you hang them on your hip. Okay. So you carry them around with you. How fun is that? No, it's not. But if you're draining, you're having to take your whole garment off to change your pads.
No.
How are they going to change them?
Yeah. Think about like a Spanx. You just like pull it open and then
Annalisa,
you change out.
Their garment is not that loose.
Yes, it is. I had lipo.
Girl, your garment shouldn't be loose enough.
It's not loose, but you have to have someone help you like open it up and change out
one thing less to worry about.
Change out the pads. Call me. Don't call her. Unless you want drains, you're more than welcome to.
All I'm saying is I like drains. They're only there for a week, max 2. And if they're in there for longer than 2 weeks, Thank God you got them. Because if not, you would be having a fluid collection. Yes or no?
No. No, I'm telling you, you literally, it's like a maxi pad. I mean, girls, once it fills up, you change out the pad.
I know, but I'm talking about after those holes close. Those holes don't stay open for long.
Lymphatic massages. And then it gets pushed out through your lymphatic system. And then you get Thermi Smooth. It's radio frequency and it smooths everything out.
Team brains over here. I'm going to stick to my guns. And
okay.
I want a drain. But here you go, Analisa. Drainless. So
I'm drainless. Sorry.
Okay, so now let's show them and teach. Well, I can't show you guys. I'm going to put it on the feed, but let's teach you guys when we're looking at before and after pictures, what are some telltale signs of a good, a bad, an excellent tummy tuck?
Belly button.
First,
number one.
Belly button. Oh my gosh.
That belly button looks like an alien. Don't do it.
Don't do it. Like your incision around your belly button should be on the inside of your belly button, not visible.
Nope.
If your incision is on the outside of your belly button, you're going to see it. It's going to scar. You're going to be able to see it.
And especially too, depending on your ethnicity and skin type.
Mm-hmm.
So like lighter skin patients heal better than a darker skin patient. It is what it is.
With their scars.
Correct.
Their scars.
Mm-hmm.
Okay. So belly buttons.
Okay.
For me, something that I always look at is how they blend the dog ears into the hips.
That's a good question to ask too, pre-surgery. Like if I have dog ears, are you going to fix it?
Yeah. What's the policy on dog ear revision?
Yeah.
Yeah.
Because sometimes it happens, And I would say for the larger patients, that would be more, an appropriate question. But if anything, anyone can ask that question,
Just ask, what's the policy on dog ears?
There you go.
Your surgeon will know.
Yeah.
He'll know.
He'll or she.
Or she, that's right. So, okay. How they blend in on the flanks into the hips, to me, is a telltale sign of somebody who knows what they're doing and somebody who doesn't.
Yeah.
Another thing is if that tummy looks straight up flat like a board, that's a bad tummy. That's not a good tummy tuck.
It doesn't look
natural.
Real.
It looks abnormal, alien, kind of like just super flat with the little hole.
You want a little bit of contouring.
So you want some definition. Like there's with that internal corset and the way these top doctors do their surgeries, like it almost looks like you got a 6-pack, girl.
Yeah.
If you get you go to the top doc.
But just understand that when surgeons are doing a tummy tuck with circulation, they can't sometimes contour because of circulation.
Correct. So that's space between your belly button and your breast, like between your ribs from your belly button to your breast, your bra line.
Right.
Is a no suction. You don't want them liposuctioning there while they're doing your tummy tuck, just because it cuts liposuction is disrupting circulation.
Correct.
And you don't want to cut it and then disrupt the circulation to this flap of skin that needs to heal.
And a good surgeon will tell you that right off the bat.
Absolutely.
They won't cut corners on that.
I know there's doctors out there who are very, they've made a brand out of doing them together.
And you can always go back and do it. I mean, it's not something that you're like, oh my gosh.
Once you do a tummy tuck, you can't do it again. I mean, you can't do liposuction. You can.
Let's let the swelling go down. And then let's see where we are. And then contour out what you naturally have.
Correct.
Yeah.
Another thing, you guys.
Good. I'm glad we agree on that.
So another thing is once that fat's out, you can't come back and say, oh, hey, never mind. I think I want a BBL.
Oh, no.
No. Once that fat is gone and in the trash.
We call it liquid gold. So once it's gone, it's gone. So decide if you want to do it at that time, do it.
Correct.
But if not, and you have no more fat and you want to come back in a year and do a BBL,
it's not going to happen.
It's not going to happen.
Or
you're going to have to do
small. It'll be a small.
No,
BBL.
But where are you going to get it from?
Well, what if they didn't do liposuction in their inner thighs? And I don't know.
This much?
It'll be small. It'll be very small.
It's not enough to be a BBL. Because also, too, ask your surgeon how much holds. That's another question. Because if you graft fat into your buttock, it doesn't hold 100%.
No, only that. You guys. That is why I have my BRUISE juice back here for y'all. I have not launched it, but it's a organic arnica balm that you can use right after surgery for your liposuction and your...
Did you say butt?
Butt.
But
yeah, it's for your booty.
Exactly.
It's for your booty.
No pun intended.
No pun intended. It's for your booty. It's for your tummy. It's for your flanks. It's for your thighs.
And honestly, guys, it's so good. I'm so excited.
Let me show y'all.
Okay. So when I held it, I was like, oh my gosh, this is so amazing.
I can't wait to launch, you guys. I really can't.
Honestly, like I held it and I was like, Mavi, this is so good. Oh my gosh. It's like super thick.
It's thick and it's
like luscious. I don't know what to call it. And I'm sorry for being.
It's like a balm. It is a balm. It's more, it's not an oil and it's not a lotion. It's
literally
and it's straight organic.
Straight up.
Arnica.
Yeah.
Like I have 4 ingredients in this product for you
and
guys.
I bruise a lot, so I'm going to use it regardless. I don't care if I have surgery or not. But
I've heard from some of my previous patients that are dancers. They're like, oh my God, my legs and my knees and my shins are bruised all the time and they can use it. But I love it. Made it specifically for my lipo, my BBL, those patients because I want them to use it. It helps reduce the swelling. It helps bring the bruising down faster.
I'm even using it on
You guys, I love it. I can't wait for y'all to see it.
It smells good. It's like, it's not too thick. It's not too thin. It doesn't have a smell.
No, I did it. No fragrance, no colorant. It's completely clean, vegan, cruelty-free, organic, USDA organic, like sustainably sourced. I was like,
I even like to use it on my cuticles. Okay, this is ridiculous.
It's good, and you don't need that much of it.
No,
you really don't. I have some pictures. Once I launch it, I'm going to show you guys of people who have used it after their BBLs and their lipo, and the things that they're telling me, I'm like, wow.
It's literally like my new lotion.
I'm so glad you like it.
It's good.
Super clean, exactly what you need and nothing that you don't. And those other arnica products that women are using after tummy tuck, after lipo, after all of the BBL, they're not made for this.
No, like they're not.
I made this for specifically for these women after BBL and liposuction. So like it's free of color. It has no
So you can use it with your perfume. Yeah.
You can use it under anything. Yeah, it doesn't matter because it holds whatever you put on it. But that's important on skin that's fresh after surgery because your skin is more sensitive after anesthesia and after surgery. So you don't want to put anything
trying to recover.
Yeah, you don't want to use anything harsh. And those arnica gels that are out there, those are meant for arthritis. Those are meant for pain in joints and stuff. And you don't want to put something that wasn't designed for
surgery.
Post-op care or post-surgery. So I can't wait for it to be out and for you guys to be able to buy it and get it and use it on your luscious booties.
And everywhere else.
And everywhere else. But the point was, arnica brings circulation to the area.
Yeah.
So when you inject fat, remember I was explaining this to you the other day?
You did.
So when you're injecting fat, why doesn't it take?
Yeah. It just doesn't take because it just doesn't hold. Like we say 80% hold. So the surgeon typically will inject.
Over inject.
Yes. So you'll feel bruised.
Correct.
So you'll feel like you're swollen.
Swollen.
You'll feel it's like too big. And then over the course of a couple of weeks, it'll go down. But this will help it.
This will help it because what arnica does is it brings more blood flow to where it's being used.
Yeah.
So the reason why these fat cells, or some of the reasons why they don't take, is because they don't get blood flow. The swelling is so tight. These fat cells aren't getting what they need. And
so if you want a bigger butt,
if you want if you are one of those girls that's like, I only have, this amount of fat and they're going to inject it and you need every single drop to take.
Yeah. I was like, we have those patients that come in and they're like, their first post-op and they're like, oh my gosh, I love it. And then they come back for their month and they're like,
it got
so much smaller. Yeah. And we're like, well, we equated for, more than what you needed. But I think this is going to be revolutionary.
Revolutionary because you can use it in those first few days after your doctor allows it. Always ask your doctor.
Sure.
Always ask your doctor. You're not putting it on any open incisions. You're staying away from any cuts.
Correct.
Only on closed skin.
Correct.
But if you can use it in those first weeks when your fat cells are still alive.
What's the difference between this and using arnica cream?
The difference is this was made specifically for that.
I'm just saying, literally, if a doctor is giving you arnica cream.
Oh, if they're telling you, yeah.
Yeah. What's the difference?
There's nothing. There isn't.
Exactly.
I know. That's why I made it. That's why I made it. I was like, they're telling you need to use arnica. They're telling you to drink it, to take the tablets, to do this. What's different from that than actually putting it on your skin?
It's the same concept, like you said. As long as you're not putting it on an open wound, it's fine.
Yeah, and I'm so excited, you guys. But okay, lastly.
Okay.
Belly buttons.
Yes.
Regular tummy tucks, extended tummy tucks.
Yes.
Contour. No liposuction between your belly button and your bra line.
No circulation. Okay.
No cutting that circulation. Mm-hmm. What's another sign for you that a tummy tuck wasn't very well done?
I would probably say... That's a good one. I think we covered it all, honestly. That was good, Mavi.
Thank you.
You're welcome. I was like, I'm going through the tears and thinking after I'm rubbing on my hands right now.
One thing though, I do want y'all to, when you're comparing photos, make sure that you're looking at their backs too, because they're getting liposuction on their back.
If it's the full... extended.
But what I mean is some of that shaping that y'all are seeing is actually being done by the liposuction, not the tummy tuck. Mm-hmm. Because a lot of that shaping is coming from behind, from the back.
Another thing too is when your waist is smaller, some patients are like, I want a big butt, Mm-hmm. And the surgeon is like, well, if your waist is smaller,
it makes your butt look bigger.
Exactly.
Yeah.
So it's like you have to, how do I say this? It's like you're comparing your waist to your butt.
It's a ratio.
Yeah.
Your waist
to hip ratio, right?
Needs to be
this hourglass, right?
Hourglass.
Okay.
Yeah.
So if your waist is smaller, but you already have a big butt, you don't want a bigger butt because it's going to
make it look even bigger.
Yeah, it's going to look even bigger. So you have to think about that proportion too. But a good surgeon will
tell you.
Yeah, they'll tell you that.
I can tell y'all, I had a very good surgeon tell me not to put fat in my butt.
Me too. He was like, absolutely not. And I'm like, why?
He told me,
like, I have no butt. And he's like, you'll thank me 10 years from now.
That's what he told me too.
Yeah.
And I actually, during COVID, I gained like 10 pounds. And I was like, I should have listened to him. My butt's getting so big. But I stopped drinking soda and
no butts intended.
I went back on a clean diet and now it's back to normal and I love it.
So it's perfect.
So I think we covered so many.
Yeah. Look, she's over here like, I know. I got a great butt.
I had help though.
I know, but still, you got a good butt.
Thank you.
You're welcome.
The whole podcast is around this. But you know what? Big butts, and I'm not going to lie to you.
There you go. There you go.
Anyways, all right, guys. I hope that was helpful. I'm going to post those pictures on my feed. So
that's
y'all
a good idea.
Mm-hmm. One thing I did want to touch on.
Yes.
If your surgeon is telling you that you need a tummy tuck and you're telling him you'd rather go with the lipo, you have to understand that they're probably suggesting the tummy tuck because they know the liposuction is not going to be enough for you.
Yes. And in that case, you have to be open-minded to have loose skin.
If you choose to only do the liposuction.
As long as you are okay with it, that's fine. But you can't hold the surgeon responsible if he or she only does liposuction and you're left with loose skin. Okay?
Correct.
So you have to decide that. And if pricing is an issue, I'm sure your coordinator or someone can help you to make it better. Because if you're a first-time person to do cosmetic surgery, they want you to have the best result as possible.
And experience.
Absolutely. And you have to make sure that you're not going to want to come back in a year and say, hey,
you might as well cut the skin off.
You might as well just do it now. Like, what the heck?
But some ladies do choose to do that.
They do.
That is an option.
Because they say, well, surgeon. I only wear a one piece when I go out for,
the kids at the pool.
Whatever. Yeah. And I'm like, okay, but in the end, when you're, with your significant other, are you going to feel confident? And you invested all this money, you invested this downtime. Is that going to make you happy? Like, those are the things that you need to ask yourself. Ask yourself. No one can answer those questions for you. You have to answer those questions for yourself. For sure.
Yeah. And I think in one of our episodes, we talked about, are you really ready for surgery? And asking yourself all of those questions like, am I ready for this downtime? Am I okay with the changes? Who's going to help me with my kids? Who's going to help me during recovery?
Right.
How am I financially going to be able to do this? All of those questions you need to have a conversation and not
with yourself. Yes.
Not be pushed. If you feel like your coordinator or your doctor is being salesy, or if you feel like they're being pushy with you or pushing you in a certain direction, I would probably think about.
Yeah. And that's why we say, go to 3 doctors, And
you'll tell the difference.
Yeah. Or DM us.
And we'll tell you. Can help you.
We will tell you the real.
We'll tell you the real. Who's good, who's good,
not. Or what to ask even if we don't tell you a specific doctor because we're not in your city.
But we could, if somebody reaches out to us from, I don't know, Long Beach, and they're like, hey, I'm going to go look at this guy.
We always know someone that we can contact and say, hey, we have this patient that has this issue, has this question, and who do you think that would be the best? And then they'll give us 3 people that you could go to.
And you guys, we have, between the both of us, we have a very large network of doctors that we can reach out to. And those doctors have a very large network of doctors that they trust.
Yeah.
And
even the doctors. Yeah, exactly.
Yeah, like,
so the doctors that we call, they're like, well, if I can't do that, well, and they're in a different city or even a different country, they'll say, oh,
send them to this guy.
Send them to this guy. Yeah. So we're very fortunate to have that in our back.
We were just talking, we were having lunch earlier and we were like, you know what? We're very spoiled with
we
what
are
we've
very
had
spoiled
in our careers and the
but
plastic
very
surgeons
blessed at
that
the same
we've
time
been.
and very thankful.
And we've worked very hard.
Grateful. And I think it's coming to fruition where we're able now to help others, because think about it. When we first, got in, we didn't have someone to ask. No, there was nothing out there.
There's nobody out there.
So it's like now we're helping others and it's coming back to us. And it's just,
it's amazing.
It's a great feeling.
Amazing,
it's a great feeling.
And now, we've had, Analisa has had doctors reach out to her from other states who, they need help training their coordinators to be like of an excellent level, because a doctor wants a good coordinator, because a good coordinator can help you avoid a lot of headache. They can keep you on track. They can, keep you away from getting yourself into
Thank you, Mavi. I appreciate
trouble.
That.
So you need a good coordinator.
Yeah.
And I want you guys to know that we're not making this up.
Just think of coordinators as your conduit between your doctor and yourself. And they're supposed to be there to be your BFF, your go-to person, your information. If you have any questions, they're the ones that are going to be there to help guide you on this journey, because this is elective. Let's be honest, right?
Mm-hmm.
We say this all the time. It's elective and it should be a good process. It should be happy. It
exciting.
Should be, it shouldn't be a burden. It should be something that you want to do for yourself, but you should have someone that is on your team that you can confide in and know that they have the best interest for you.
And I think that's why it's so important for there to be independent patient coordinators who are not tied to an office, because a patient can come and we can look at it as a whole and like, okay, these 3 recommendations would be the best, for you because of these reasons. Right. For example, if a larger patient is looking for a procedure, I'm going to send her to a doctor that I know does larger patients. Yeah. And if a patient is looking for a specific procedure, I'm going to refer them to,
or if they only are wanting to do insurance.
Correct. If
because a lot of plastic surgeons
don't take insurance.
They don't take insurance,
but some do. And I know who does.
So those are the great things that I think we can offer.
Yeah, I think so too. I mean, I'm like, every day I wake up and I'm so excited and I'm so happy with what we're doing together, what the community that we're building, because I've had women reach out to me and they're like, girl, I've been looking for information. There's so much out there. What's the truth? What's, and a lot of the stuff that's out there is women telling each other. No, like patients telling patients. Yeah. And it's like,
but it's biased because it's like, it's only what they know.
Correct. It's only what they know.
They don't have that broad spectrum. And since we've been in the industry for so long, we have many contacts
and very different style surgeons. Like I've worked with different style surgeons.
Correct.
And I know you've worked with different style surgeons, and it's very important because you get to see more than just
Yeah.
You know, one doctor that you're looking at their before and after pictures because he did your surgery.
Yeah.
We're seeing
and it's, a plethora of stuff. Yeah, exactly.
I know these patients are sending me messages and telling me that we've been helpful, and it makes me so happy. And I hope to continue to be helpful for you guys.
Yeah.
And y'all have really been like such a huge part of our journey.
Yeah.
And I'm like, yes, I can't wait for BRUISE Juice to finally be out.
Yes. Actually, I'm still like rubbing it on my hands, right? I was like, this is so good. Oh my gosh.
You guys, you don't need a lot. It's literally a small jar, but you don't need a lot.
No.
It's enough. Like one little scoop is enough for your whole booty. That was
it. And your whole booty.
Yeah, it is. She put a dab on her hand. I
did. And I'm like, I'm still like,
rubbing it in.
Under the covers. You're like.
Anyways, all right, you guys. I hope y'all found this helpful. I hope you now know. Great information.
Yes. Please DM and let us know if you have any questions or if you want us to do a specific topic.
Yeah.
Because there's so many patients that have been great with DMing and saying,
specific topics.
This is what I want to do. Or
one last question I'm going to answer for somebody who sent in a question, which was, do you really need massages after surgery?
Depending on the doctor.
Mm-hmm.
Okay. We always go back to that. You always have to ask your professional or physician. Yes. But typically, if you're doing liposuction, the lymphatic massages are amazing. Thermi Smooth is amazing. It's radio frequency. It feels like a hot stone massage. So it's kind of a tuber.
You guys.
I loved it.
Let me tell y'all about Thermi Smooth.
Yeah, it's so good.
When I was with an old practice I worked with, I helped them do the Thermi Smooth study.
Right.
And being one of the main ones doing the treatments, I was the one that figured out, hey, like this is taking the lumpiness away out of some of this stuff. Like revision lipos. Revision lipo, it's almost impossible to not have, you know, a little bit of irregularity.
Yeah.
And the Thermi Smooth really helped.
Just like think about it like evening out the plane. Like you have like these imperfections or these divots. And this hot stone massage that you can do, it's outpatient. You can do it in like 45 minutes. Yeah, exactly. Feels like a hot stone massage and it just like smooths everything out. It's amazing. So if your provider provides that, ask them for it.
And if they don't, ask what their recommendation is. But
for it, yes.
Massages, in my opinion, are important. I know that when I had my surgeries, I felt amazing after my massages. Even on my breast reduction,
just feels good.
It felt so good, and I could tell the swelling just go away. So I say you do need the massages. Now here's the controversial part. How many do you need? Because there's like some people who do 3.
True.
There's some people who recommend 5. And there's some surgeons that recommend 30.
And some do that because they do packages, right?
Mm-hmm.
But start small. You can always add.
And just go with your doctor's recommendation. If he says you should do it, do it. Another thing that I think is a little controversial is, do I really have to wear a garment or should I be in a binder? Yeah. And that, you guys, you have to talk to your surgeon. Whatever they want you in is for their own reasons. I know some old school, like older doctors still use the binder. But if you ask them, hey, can I change into a garment? Most of the time they won't have an issue with it. And they'll just say, yeah, go ahead, change into a garment. But they work in hospitals that only have these binders and those types of things. So and they've been in practice forever, and they're not they're not trying to change it up. They're about to,
Yeah. They're like, oh, yeah, whatever.
Fine.
Yeah.
And, that comes to the point of, I think it's very important for whoever you go to make sure that they're staying with the times.
Yeah.
Make sure they're staying
they're
on top
up
of
with
it.
the times, because there's some doctors that are older, like 30 plus years into the game, and they don't want to change.
And they don't go to the meetings. They don't follow up
go
with
to
what's
ASAPs.
new.
They don't anything. And then there's other doctors that are 30 plus in that they are
all
ahead
about
of the
it.
game.
They're the ones giving the talks.
Yeah, they're actually on the podium. They're the ones like teaching the younger doctors what to do. So you have to take that with a grain of salt. But just, of course, ask your doctor. Always. First, listen to them and go on their guidance. Because if you signed up with them initially,
then you must trust them. If you're doing your homework, if you've done your 3 consultations, you trust this person. Yeah. And if they're telling you to stay in a binder, you stay in a binder.
Stay in a binder. Yeah, exactly.
So this goes back to doing your homework, making sure you trust the person that's doing your surgery. Yeah. And I tell you guys this all the time because it's important before surgery, but it's crucial after. Because if you don't trust them after and they're telling you it's going to be okay and you don't believe them, what are you going to do? Yeah, what are you going to do if they're telling you, hey, it's fine, it's just a little swelling, or, it's just it looks like a normal bruise, but you've read online, you're convinced it's a hematoma. Yeah. And you have to trust your doctor.
Yeah. Just do that. Just ask. There's no dumb questions, especially if you're having an issue. You should have really good communication with the office and you have a direct point of contact to, ask those questions. If it's a week after surgery, 2 weeks after surgery, those 1 week, 2 week, 3 week, 4 week, those are the most specific times that you should be asking questions if you have a question.
Definitely.
And making sure that you're following their instructions. So it's communication from both parties, but also doing your due diligence with making sure that you're following their instructions because they've obviously been in it for so long and you picked them for some reason or another. So you got to go with it.
And I think that's a good,
it's a good
ending point for us. Trust your surgeon. Make sure you do a good job. And if you have a question, just DM us.
Ask us questions.
Send us a question. I put stickers up on my stories all the time. You guys, I know I've been getting a lot of love in my DMs.
You have actually.
Yeah.
Oh my gosh.
And I want to tell y'all, if you want to, help us, the way you can help us is by giving us a review on Apple and Spotify, because the more reviews that go up there, the more people know, I guess, hey, there's this plastic surgery podcast. I wonder what these girls are talking about.
Because organically it's already been happening. And I was like, oh my gosh, what are you talking about? And Mommy's like, yeah, did you know? And I was like, I haven't checked, but I'm going to check.
So we have some reviews on there, and it's some of them is people I don't know. And that makes me so happy because I'm like, yay, I'm helping people.
I think the main goal is just to help patients that don't know who to ask, where to go,
who to trust.
Who to trust. They don't have a friend or a family member. There's so much information.
There's so much information. It's confusing. And if you don't have somebody who knows, you can really give yourself anxiety and just, this is what happens. Because it's a big step. Let me tell y'all what happens. I know I keep saying, oh yeah, we're going to wrap it up, but let me tell y'all what happens. You decide, hey, you know what? I think I want to have liposuction. You go online. You start looking. Before you know it, you're looking at botched pictures. You're looking at worst case scenario.
And it freaks you out.
And you're freaking out. And now you're like, okay, maybe not. And then you put it away. And then you look at it again. And then before you know it, it's been 2-3 years and you're still thinking about it. And it's because that first initial search can be so overwhelming. Yeah. So that's what I don't want to happen. I want you to think about it. Find me so you can find good information. Yeah.
Call us, text us, DM us, whatever you need to do. We work for a lot of doctors and it's just, I think it's just one of those things where we're just very happy to be able to pass this along and to help others and to give back the knowledge that we've gained
and
over
many
14
years.
I don't even know how many it is.
Many years. And you guys, when I said we were spoiled, I meant by the knowledgeable doctors that have been around us. Like I have had the privilege to work with like great, excellent physicians who I know care about their patients, and I know their intentions are right. So I feel we
like to connect them with patients that have good intentions as well. Yes.
Correct.
Yeah. Going to ASAPs, I think every year for the past, 8 years.
Yeah.
I don't know, whatever it is. And I get to see all these doctors come together in a group and they do, round table and hot topics.
They talk
about great things and innovative things.
For example, the BBL, the safety stuff. Like there's meetings about this stuff, you guys, and they're talking about it, and they're, researching. And we have a facility here in Houston that's doing, a lot of research in that field.
Because there's a lot of doctors that will do BBLs. They'll take out X amount of cc's of lipo, and it's not safe. The BMI for the patient is not correct, and they'll inject and they'll do underneath the muscle, which is not correct. And it's not safe, and it's just one of those things where I know I'm educated and I tell my friends, my family, and people that DM me, nope. Don't do it.
Don't do it.
Just go to this doctor.
Go to this guy.
It might be a little bit more, but that little bit more is worth your safety, your sanity, and your health.
BBL is a whole topic, and it's a whole episode by itself because I have so much to say about it that I'm like, this will be turned into a 3-hour episode if I don't cut it right now. I think
if anything, we always just continue to talk. I think because we have so much information that we just want to we just want to spill it out to everyone and let them know everything that we know. And I think it's just the patient safety, and we honestly want every cosmetic surgeon, every plastic surgeon, every patient to know that they have an advocate.
And they have an ally. They have an ally. So I know sometimes coming out and saying, hey, I want to have plastic surgery, and your friends or family might be like, why? You don't need it. And then you kind of get like, okay, well, who am I going to talk to about it?
Right.
We're here. I'll talk to you. I can talk to you about it in my sleep.
Right.
So
whatever you need.
I'm sure we can find it or figure it out.
Well, I think this has been great, Mavi.
Me too. I
love you to death. And thank you for helping me on this journey. I know I told you the BRUISE JUICE stuff, right? I was like, oh my gosh, it feels so good. Okay, I dropped my AirPod again. Sorry.
All right, you guys. Thank you for tuning in. And I hope you found this helpful. I will see y'all next week.
DM us if you have any questions.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.